Hip arthroscopy is a procedure that we do on the hip where we look inside the hip with a camera in order to see the joint and the labrum and other structures in the joint. It's a surgical procedure. Although it's not a big, large invasive surgery, a lot of work can be done through those two small incisions. The most common indication for a hip arthroscopy is for a labral tear, and that's a common term that you hear around the internet now is labral tears. And what it is it's a tissue in the hip joint around the edge of the hip joint that can become torn. Usually it's soccer players and hockey players and runners that get these tears, but nowadays we're seeing it in most every athlete. If you do have a labral tear, some of these are treated without surgery, but unfortunately some of them do necessitate the labral repair from a hip arthroscopy. And the recovery is a very long recovery sometimes, so it's not something that we just do on every tear. But if you think that you might be a good candidate or you have pain in your groin, I would go see your orthopedic surgeon to make sure that you don't have one of these and don't need a hip arthroscopy.